Hi guys, I'm just going to do a little autobiography about myself so that you kind of get a little insight into who I am. So, one of the questions that people usually ask, how old am I? I'm 29 years old. I turned 29 December 10th, just gone. Um, am I married? Yes, I am. I'm married. I've been married from since 2014, so currently that's like what, three years? Pushing four? Yeah, 4 years, February this year. Do I have kids? I have a boy and a girl. My boy he's 4 months, and my daughter's 3 years. Um, how do I manage the time between having a family as well as trying to go to school full time and work and support my family? Um, I try I try to do my best. Since I'm self-employed, it's not so bad, but I'm actually trying to get a job in accidental emergency at a main hospital here to see if I can supplement my income and actually afford to pursue this endeavor. So time is very precious. Um, Sometimes I end up missing a few important milestones in terms of, like, for instance, like with my daughter. Sometimes I might not like I might forget, like, for instance, I might not be able to attend her birthday party or be there for the full day of her birthday party. But this year I was lucky enough to be there. But a couple years back, I probably was like at her birthday party for like maybe 20 minutes. Then I had to dash out to go and deal with an emergency. And then I missed a few baby showers a baby shower in there too. This year I was lucky enough to be there for my son's baby shower. Um, how do I handle a rough day? I pretty much just keep to myself. Most days in dentistry are kind of rough, but I'm not saying that to discourage anybody, because dentistry it's a lovely specialty. Medicine's a lovely specialty as well too, but it's tough because you're trying to just balance so many things in one day, and between that and trying to our dental school is right here in Jamaica. By the way, I'm Bajan. I'm from Barbados, but our dental school. I'm actually in Jamaica, so our dental school here is kind of a little bit more strict than I remember medical school being. So, for instance, a lot of things that you probably would take for granted, whether it be just cracking a joke or whispering to a friend in the lab, they don't allow that so much here. So you can actually be graded down for your deportment in the lab. So you just basically have to zip your lip. So simple things like that there kind of just make this even more challenging, but I know that it's worth it. Um, Next question. Qualities to being a good surgeon. Patience, lots of patience, because to be a surgeon takes a long time. For oral and maxillofacial surgery and pretty much most surgical specialties, you need at least 6 to 8 years postgraduate in the Caribbean or in the UK, in the US, 6 to 8 years, sometimes all 10 years, because you have to do a subspecialty as well too if you want. Patience, you have to be dedicated. I'm very dedicated to the oral and maxillofacial surgical specialty, and I'm very dedicated to pursuing this endeavor. I love surgery, and the reason why I love surgery is because I actually think that, for instance, if a person has something wrong with them, it's one of the few one of the few specialties, I think, that in general you can change a person's life pretty much same day. Person comes in intestinal obstruction, you operate on them, they cannot pass feces for 3 days, and you do an operation on them, and they can pass feces maybe in a couple of days after operation. They're back to normal. There are some specialties that are medical that you can do that too, but I find with surgery it's very clear cut. There's a drastic change in a person's life. Most 9 of 10 times there's a drastic change in a person's life. Why did I choose surgery? Well, basically it's simple. My mind works like how a surgeon works. Surgeons to me are like mathematicians, while persons who do medicine are like persons who like English, like to read, and they like to create diagnoses and those kind of things. Surgeons tend to be like 2 plus 2 is 4, 3 plus 3 is 6. They are very straight and to the point, and that's just how their brain works. And I think my brain works like that. I love to just scrub into to surgery. I love to just operate. Whatever I can do in operating theater, I just love to do it. Um, why oral and maxillofacial surgery? Um, it's one of the. How can I explain this? It's not that I've ever had any oral and maxillofacial surgical procedures done to me on a whole, and I've seen a very small number of surgeries done by oral and maxillofacial surgeons here in the Caribbean because there are not very many. But I've seen a lot of ear, nose, and throat surgery done, and I think I just love the fact that it's microvascular surgery. I like challenging things, and I like the fact that it's very small, and you know you're using your loops, or you're using the binoculars to do very delicate procedures, and these small procedures can actually induce large changes in persons' lives. So that in itself is just so fascinating to me. Um, do you like dentistry? Yes, I do. I like dentistry. I don't think I have to explain that anymore. Do you like it more than medicine? No. In terms of medicine itself, I like medicine more. In terms of dentistry, in terms of who you work with, I think dentists are kind of nice, to be quite honest. And I know some of my colleagues will probably laugh and say, but I actually find dentists to be they're like surgeons. They are surgeons because it's doctor of dental surgery. They are surgeons. So a lot of the times when 2 + 2 = 4, like I can be like, yes, that's true, yes. But in medicine, from the point of view of the coursework, I like it more. But dentistry tends to be a little bit more demanding, and that's something that makes it a little bit more challenging in terms of being me saying that I like medicine more. So for instance, if I did dentistry first, I would have had more time to work and study, well, because the coursework of dentistry is more demanding. But with medicine now, doing medicine first and then dentistry after I have little time to do any sort of work to raise funds for school. So that from that point of view, yeah. So in essence, I like medicine more because I had more time to myself in basically during the coursework, like the first 3 years. After that, in the fourth and fifth year, it got a little bit hazy in terms of what I like because you have to do call. But yeah, medicine first. Other questions. Qualities required to be a good surgeon. I think you just have to be a nice person. You have to like to help people. The usual manual dexterity and good hand-eye coordination is one aspect of it. But if you are an awful person to work with and you're working around people and no one likes you but you're the best surgeon, you can actually kind of do more damage to a team than if you're a team player. You're nice to be around. You might be a decent surgeon but not like world class, but you're decent. You can actually do more good than a person who's talented but just terrible bedside manner, terrible to work with. I mean, I've worked with all kinds of surgeons, and some nicer than others, and I can honestly say that those that tend to be more mannerly or even just nicer to work with and treat patients very respectfully, I would say that they actually tend to be the better surgeons than those that are pompous and arrogant and have that what people say is the God complex. So from that point of view, I just think you have to be confident but approachable, just downright cool, What do you bring to oral and maxillofacial surgery that's different? That's a hard question. I would say I wouldn't say it's different. I would just say that from the point of view of oral and maxillofacial surgery, I actually like to work with my hand and I like to build stuff. So I plan to finish oral and maxillofacial surgery, specialize probably in microvascular and head and neck surgery, and then go on and do a degree in biomedical engineering, and hopefully build better equipment to be used in oral and maxillofacial surgery. I'm not really into the research aspect of oromaxillofacial surgery or even surgery. I like to build stuff. I like to just use my hands and build. So while a lot of oromaxillofacial surgeons tend to be academics, I'm not so much into the making of, doing all sorts of papers and stuff. No. So I think that will be a little bit different, although I'm pretty certain there's somebody out there who has done a degree in engineering after. How is your work-life balance? I think I've answered that already. My biggest inspiration, my mom. I know people probably going, oh, no, yeah, but my mom, seriously, like my mom's been, like she's that person that if I'm feeling stressed out and I call her, she gives me the best advice, and I get stressed out very, very often because of trying to, fund this degree. So, my mom's very, 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 very level-headed. She would have been an awesome surgeon. She's not a surgeon, but she would have been an awesome surgeon because when things get stressful, she's able to just, gather her thoughts and be quite level-headed and finds a solution. Another person that I find that's my biggest inspiration. Well, a person I have to mention is Dr. Nigel Sean Matthews. He's actually from my country, Barbados. He's an oral maxillofacial surgeon in the UK. He's actually moved on to University of North Carolina in the US. I admire him. I admire his humility. I saw an interview with him on YouTube, and just the way how he was just answering the questions. He wasn't saying, well, I cured this person. No, it wasn't that. It was just so level-headed, very calm, very cool, very quiet. But it seemed like a very approachable person, and I just like that. And apparently he is one of the leading temporomandibular surgeons. He deals with temporomandibular joint surgeons in the UK. So I just like the fact that he was so level-headed and so humble. What advice do you have to other students? Don't advertise what you want to do so much in terms like when you're a student and if you want to do, like for instance, you want to be a cardiologist or a surgeon or whatever you want to be. One thing I've noticed, and this has happened to me as well too, is that when you tell persons if you're not really so confident at that point in time, if you tell persons your aspirations, persons tend to find excuses for you not to pursue whatever endeavor it is. So my advice, keep your thoughts to yourself. Questions, yes, ask persons around you, for instance, what you want to do, but like ask them about how do you go about becoming this and that surgeon or that specialty, right? But don't advertise it so much to the point that people get ammunition to try to shut you down, because you'll be very surprised how many persons try to like dissuade you from doing something that's so positive, even though it doesn't affect them in any way. And that's not everybody, but that's some person. So that's my advice to you. I think I've answered all of the questions. That's 14. Yes. So thanks for the support on the channel, and please keep subscribing to my channel.